Guillain-Barre syndrome is a rare immune-mediated polyneuropathy disease. It affects the spinal nerves and it can also affect the cranial nerves. The cause is not really known, but it usually happens like this. Somebody has a viral infection or a respiratory infection or a GI infection, or perhaps they've had the flu shot in the last 2 to 4 weeks, and they start to develop these characteristic signs and symptoms. And usually they're going to need to be intubated for a length of time. They do recover from this syndrome, and then all is well, but you have to recognize it early to make sure they get the treatment they need. So the signs and symptoms of Guillain-Barre include numbness and tingling of the feet and hands. They can also get pain in the shoulders, thighs, and pelvis, and you have to put the scenario together. So somebody that's had a flu shot or somebody that's had a respiratory illness 2 to 4 weeks ago, now they present with these problems. They have ascending paralysis, meaning it starts in the feet, paralysis, and starts to move its way up. When it gets to the thighs, you have to start thinking about the respiratory muscles and that this patient may need to be intubated for a short amount of time. People with Guillain-Barre are going to need breathing support, so they'll be mechanically ventilated. They may also get something called plasmapheresis, which they take the patient's plasma from the blood and it's washed to remove all the antibodies. So that helps with recovery and usually decreases the amount of time they need with mechanical ventilation. They can also receive IV immune globulin, and then this is to shorten the recovery period. They're going to need tube feedings while they're mechanically ventilated. Oftentimes they may even get a paralytic ileus where which means there's no peristalsis, so then they would need like PPN or TPN. Most people with Guillain-Barre treatment do recover and they're walking within 6 months.